This topic is technology augmenting hospital management. So it is not related to clinical aspects. It's purely management. Dr. Harshad Soni has just joined. Thanks, Dr. Soni. Come. Take chair.
Yes.
Nice there. First of all, I would like to introduce everybody. Dr. Soni is a surgeon. He is with Kaizen Hospital. Rajiv Sharma is the CEO and Managing Director of Sterling Hospitals. Dr. Vishwadip Goyal is the CEO of Apollo Hospitals. And Dr. Vidyut Desai is a surgeon. He is very much interested in hospital management and has been past president of AMA. I would like to make this session more interesting and interactive. So it should not be a monologue. I want the audience also to participate. And when we talk about technology, it is not just the use of WhatsApp or mobile. There is much more than that to it. Considering the advances in technology that is taking place, I think the topmost three technologies that are going to change hospital management and other fields in the coming years, and that's not going to be very far off. Not exactly in the same order that I'm talking about, is going to be artificial intelligence, AI, machine learning, ML, and 3D painting. All these technologies are already doing a huge disruption overall in many other fields, and I'm sure healthcare is not going to be far behind. And when I'm talking about healthcare, I'm talking about the hospital management. For example, there is this pills. So it's a box which is a wireless pill box which will remind the patient when to take the medicines. It turns blue when the patient has taken the medicine, and it will be red if it is not taken. So simple things like that are going to make a lot of changes. Bitcoin, though is not a legal tender, it will definitely make a huge difference the way we do transactions if it becomes a reality. And I'm sure, though India has not made it legal, in years to come, if it is going to be a very secure way of transacting, it will make a huge difference. So these are the things which we all should be aware about and should be prepared, because the way technology is changing fast, if we don't keep pace with that, we will remain behind. By 2020, 70% of the population of the world will have smartphones. So it's going to make a huge difference everywhere. Right? So if we start thinking about how we can use that for enhancement of hospital management, it will really make a huge difference in terms of savings, better communication, and so many other things. So let us start with some of the general questions which I will throw open to the panelists. And I start with Rajiv. As head of the organization, like what percentage of time do you actually spend in planning technology upgrade, technology augmentation in hospital management? Do you get time, or do you wish to have time? Can we have an additional line?
See, so when we talk about technology, I'm not going to discuss about the healthcare information system, because that is, you can say, a technology that is must have for any hospital operation. I think when you talk about how much time you spend or what kind of mental time you allot to thinking about technology, I think it is fairly limited at this point in time. In fact, our budgets are also in hospital. I mean, I'm going to talk about only our hospitals, is fairly limited than what it should be. And that is, it stems from the kind of market we operate in. Just to put some things in perspective, I mean, in India, per capita healthcare spend is about $60. Okay, whereas in US it's about $6,000. Similarly, if you look at even some of the other developed healthcare markets like Australia, Australia, etc., it's about $6,000. So almost 100 times. So, and what it means is, I mean, we are in an industry which is people driven and which is for people. So you treat patients, and they are basically treatment can be done by people only. Okay, so technology in our case is an enabler. Now technology is moving towards a stage wherein it can be more than enabler, but at this point in time it remains an enabler. So what it means is that, whenever there is a resource crunch or a time limitation, you'll always tend to prioritize patient care, and because that is what you are in this business for. And that is the reason primarily technology planning and conceptualization takes a backseat somewhat. But I would say that, I mean, that because of my own personal interest or otherwise, I would say at least 10% of the time do get spent on figuring out technology, because at my level, let's say at a very, very high level, technology is something that can really make a difference in the way you manage. So for example, let's say now we have 6 hospitals and we're planning, let's say 1 or 2 other hospital. Unless at my level, if I don't have a business intelligence tool, and we do have one now, which we acquired recently, it'll be very difficult to manage. So technology has become an integral part. Now, as technology evolve, it will obviously will bring in more efficiency. So to answer your question and give a background information, I guess it's about 10% of the time would go into really dealing with technology at this point in time.
Thanks, Baju. So, again, the crux of the debate or the discussion is that we need to spend more time in technology, discussing with the team and trying to find out what better technologies are available. There is generally a resistance in adopting the new technologies. That is what I believe. Especially talking about healthcare, whenever you talk about a new technology, there is a huge resistance. It starts with the doctors. And we all are used to doing the mundane things in the same way that we have been doing. We don't want to change. Do you all agree? Yes. What is the reason? Is it our own psyche? As Indians, we are more subjective and not objective. Is that the reason we usually glorify beauty, we glorify culture, but we are not objective about changing things. We abhor or we don't like a lot of changes in our life. So I'd ask Vishwadip, since he has just joined Apollo as CEO and has been working with Manipal, has also worked with government. What do you believe? Do you think that the staff is not very accustomed to new technologies? Though they may be playing with WhatsApp and video games, etc., when it comes to actually using technology in hospital management, there is a huge resistance. They don't want to do it, or they will find out some of the other excuses.
So, as you rightly said, that there is an inherent resistance to change, first of all, and as the speaker previously from HMR was also mentioning about it, we guys don't want to change. So whatever we have been doing, we feel that is the most efficient way. I think that becomes the challenge. So, and then managing that challenge and informing the concerned person, the end user, of what difference it can make it to the day-to-day activities they are doing, or how it can help them to improve their services and the kind of care they are providing, especially to a patient in our industry. I think that is very, very important. So the inherent belief that we have that whatever we have been doing for so many years, it has worked so well for us till now, and it will take us even further. I think that mindset is the biggest challenge. But once and whenever we have to do any kind of a new technological intervention, we should always keep the patient first. So whatever change that we want to bring in, if it is patient-centric, if it is helping the staff to deliver a better care, be it in terms of the HIS, which is becoming a routine nowadays. So that has helped hospitals save a lot of money, bring it a lot of efficiencies, reduce the work for the staff as well. So that has been accepted. So now we have to move forward. So it has to start with the doctors first. Once the doctors, they start believing that any technology that we bring in is going to help them deliver better care to the patients, I think the battle will be won. And then it becomes easier for the other categories of staff to be influenced to accept that change.
Thanks, Vishudip. So that was helpful. I would like to ask Dr. Vidyut Desai. He manages a nursing home. Like what you might have seen better technologies being used in other hospitals. At your level, like in nursing home, what kind of technology change you would like to bring in, or something which is going to help you overall in managing the nursing home?
Friends, our health services scenario, I think let us have the bird's eye view of our health services scenario first. To my knowledge, the federal government is spending 2.5% of the budget after healthcare services, which is much less than what is globally average, around 5% or more than 5%. So this is one thing. Second thing, that more than 70% of the healthcare services are provided by the private sector at present. And in private sector, these services are not uniform. It is segmental. Segmental by what I mean, Dr. Gadwal has rightly asked that the small nursing homes, general practitioners, primary healthcare centers. So all these units, they are still lacking the basic requirements of the standard treatment which can be offered to the patients. We are not talking of the remote areas till now. With the telemedicine, it has been possible to provide the expert services at the remote areas or even the border, at the border of the country. It has become possible, but it has not become, or it is not affordable. And the aim of the country for the healthcare services, I think, should be the standard or the quality services at the affordable rates and with the availability of all the primary things. With the advancement of the second point, with the advancement of the technology, at one side we are advancing the technology, we are trying to use it, but the basics are being left out. Say the use of stethoscope, I think it has become very much limited. Coming to the point and the question of Dr. Gadwal, that the nursing homes of 5 beds, 10 beds, 20 beds, or around that, are at present almost gasping. And in the due course, in future, and probably in the near future, if they and they will require the services of the ultra-modern technology. So the question, I think the practical approach should be adopted by and large. So for the technology and the advanced technology of the ultra-modern technologies and its uses, always welcome. But it is welcome in the corporate or the tertiary centers of the government hospitals. And what I have learned, that the Mediclaim and the insurance companies are also going to raise their premiums very shortly. So looking to everything, the feasibility of what we are talking about should be well understood. And I think that is the basic requirement first.
Thanks, Dr. Vidyut. So what he says is we'll have to really adopt, even the small nursing homes might have to adopt new technologies so that the cost can be brought down. I'd like to ask the general audience, like there have been technologies in vogue since many years, but how many of you have actually used, like RFID tracking? Okay, it's a very simple, very cost-effective way of ensuring that your assets are tracked, your employees can be tracked. But is anybody using, any hospital amongst you? So these are simple technologies. They've been brought in at very cost-effective rates. They can be used for tracking assets, tracking your patients. Like if you ensure that the cards that the patients are wearing, if they are embedded with RFID, some of the patients, specifically some patients who have psychological disturbances, who actually run away from the hospital. I've encountered in past that patients have run away and we had to send security to find those patients. So by adopting such small technologies, you'll be able to really make a huge difference. Same way ambulances, tracking your ambulances. You don't know where your driver is going. He might be just taking a side route to reach his own village, go and have some social visits and then come back. So all this can be actually tracked if you implement the mobile technology in the vehicles. There's a vehicle tracking software available. So this can be done. They are all there, but I don't know why there is a resistance, why people do not actually do that. Correct? Can you all at least make sure that in 2018 we will try to use one technology? Yeah? Because this is going to be helpful. Why do we want to continue doing the same or the other thing, right? Okay, coming to the next question, which will be more of technology for operations and general administration. I would again ask Rajiv, can you give an example of one technology that you have used for improving hospital operations and your own experience in using technology for that?
So, Bharat bhai, you asked me to give one example, I'll give you 4 examples. Because that's what I've noted down. So, see, what personally I have used and we've used at Sterling is basically, one is telemedicine to connect to remote centers. So we have hospitals in Gandhidham, earlier we had hospitals in Mundra, etc. And we've used to connect, telemedicine to connect either doctor with doctor or for, you can say mutual consultation, or let's say seeing patients at those centers from far-flung villages. We've also utilized technology in digitizing our health record, because it's a non-core activity. I think all the hospitals have that, and we've used that to digitize health records. We've also used technology in terms of business intelligence tools. So, for example, recently we've got access to a business intelligence software wherein you upload whatever your data from HIS is uploaded on the cloud, and based on that data there is a specific formatted report you can get, which is tailor-made to what is your requirement. Or let's say, so a different level requirement will be different. So you can tell, let's say, what is a hospital manager's requirement, what is a CEO's requirement, and based on that you will get those reports automatically on a regular basis. The other thing I think which is very, very common in terms of technology, which wasn't there, let's say 3-4 years back, is basically social media. I think while I'm not talking about the routine WhatsApp, but WhatsApp obviously has been a very, very powerful tool in terms of campaigns, in terms of spreading information. But the other thing, something, let's say a new thing has been Facebook Live that I've come across. So our team has been using Facebook Live to connect directly with consumers, propagate information, connecting clinicians directly with that subset who's specifically looking to connect with them for asking general questions. They may not be patient, they might be just seeking information. Apart from that, I guess the other thing has been, I think this covers most of the points that I wanted to make.
Thanks, Raju. Yeah, I fully agree. Social media has been really used very well.
Tracking of the trainings is going to be online. So it is going to be the prerogative of the individual, of the employee himself or herself to attend a minimum number of trainings which are mandatory for them. So they have to go online. So they have to attend the session, and then there is a definite period window of around 4 to 6 hours during which they have to go about and then mention that yes, I have attended this particular training. They have to mention a few brief about what they have done, what they learned, and then only the attendance will be marked. So it is online tracking of the training that has been conducted for the employees. So at the end of the month, so there will be a complete report that can be generated, which can be seen by the HOD of the employee. It can go to the HR as well, to the personal files as well, and at a group level also we can see how many trainings were conducted and what is the efficacy of those trainings as well, because there is a slight brief that is mentioned by the employees as well. So this will actually help not only improve the efficiency of the training systems, but all the manual work that used to be done in running around after the employees to go and have them in the room and then conduct the trainings, that is also taken care of. So it reduces the cost, brings in more efficiency, and makes the training system also more effective. So that is one way we have tried to bring in technology and improve the system as well.
Great. Thank you, Shudip. So the next question is to Dr. Arshad Soni, who is a clinician, he's a surgeon, and he must have faced problems related to nursing care in his hospital. Do you visualize that you get rid of the existing nurses, those nurses who are present, and replace them with robo-nurses? They do whatever is fed in.
Common mistakes that can be done by the nursing is like the end product. Like previously in the same hall, there are a few lectures for the tagging RFID coding and everything. But if you see the end result can be given only by the nurses, and if their training must be in a proper way, and this use of this RFID can definitely make a difference. Like also the drug, which is labeling of the drug, RFID code of the drugs, that makes a difference, and all the adverse effect of the hospital can be reduced only by that. Like almost according to the present, it is 99% is reduced. So it should be reduced. Almost 80% of the, according to literature, it is 80 to 90% it can be reduced by the RFID codes. So it is really good if we do that part. And second thing is the training of the nursing staffs. The trainings, again, the same thing is told. Like the training to the staffs are most important task due to attrition rate at the hospitals, changing of the staff, newer staff which is coming. So repeatedly giving them the training and set them to the hospital environment. It is most important. In this part also the technology can make a difference.
Thanks, Dr. Arshad. I think you'll be able to, yeah, please.
One question to our hospital CEO. Like I am a consultant, and we have the patients, like 5 patients are admitted in each hospital or different hospitals, and those all patients are on the different medications, and we have to monitor vitals to all the patients. So it is humanly impossible to remember, and during the even consultation we get the call from the hospital nursing staff or medical officer, and we change the drug on that particular patients. Is it possible, or is it practical that you put all the data digitally, like we have the application from different hospital, so we can track our patient, or even before visiting that hospital, we have the track records of that patient, so we can, just a minute, sir. So we can plan that treatment accordingly. Because in ICU, some hospital have started to go putting that medications, but in wards or in other part, it is not implemented. Thank you.
See, we've done exactly what you're saying, and we experimented it with, wherein, we had a mobile app which was linked to the hospital information system, and at a predetermined time, whenever a consultant is leaving or coming to hospital for the round, let's say they have 5 admitted patients, they'll get all the information related to those patients, whether in ICU or otherwise, automatically. Let's say at 10 o'clock, if you happen to come to Sterling, so at about 9:30, you'll get all that information while you're driving. That's what we tried with. But what our experience has been that, clinicians after some time, they stopped using it. So what you said is absolutely a very, very powerful tool, and I'm sure some of them might be using it still, because we bought only about 10 to 14 IDs to be given to consultant. There hasn't been request for the 15th. So
When it is required, because the Uber driver can use the technology,
It is,
while the
yes,
consultant cannot. It is very difficult. Sometimes when I change the order over the phone, it is who can track the record?
It is implemented.
Whether I have order or not.
Nowadays the web-based technologies are there, and all like this Indimedi, they have the web-based technology, and on our mobile app, it's like an app, and we can track our patients with the treatment, and everything is nowadays it is available. So it is our habit that we have to do that part. That's our habit, yeah.
Could be by app, not by phone.
To add to that, I think real-time tracking of patients who are especially in ICU settings, so that is also possible, and we have been using it. And not only the access can be provided to the consultants, and in fact, to take the technology further, so Apollo has started a concept of e-ICU. To what sir has already said, that we have taken the technology that as telemedicine is used to bring effective and better patient care to the border areas or to far-flung areas. So with ICU concept, a patient who is in a basic ICU setup in a distant place can be monitored at a tertiary care center like at Apollo. So the doctors there, so through the licensing and through the technology, the entire real-time tracking of the patient is done at Apollo, and wherever any intervention is required, so the doctor there at the local center can be guided to make that intervention. So that concept is already there. Yes, the challenge is the acceptance of the technology both by the patients, by the local hospital and the physicians.
I think what is required is a better coordination between the IT and the hospital management. We supply the software to the world, but we do not have the best of the softwares in this country. Probably the cost, the Western countries can afford the cost, whereas we are not able to. They have the best of the softwares made by Indians. Like Infosys has made an excellent software which is for tracking quality dashboard. The same is not available for our own hospitals. I don't know why they are discriminating. We need to really talk to them that why this gross discrimination. Talking about 3D printing, that is already making waves, and people are actually building houses in hours through 3D printing. The same 3D printer can be used, for example, a cath lab part is required and that has to come from Germany. By 3D printer, you can actually print it in minutes and ensure that you don't have to import that from Germany. The same is printed here and you can apply that. So those are the things which can be, which will come in vogue in the years to come. 3D printing is going to make a huge difference. I've seen that machine in one of the exhibitions in Dubai, and they're exactly replicating some of the bones, like pelvic bone, etc., are being 3D printed and can be implanted in the human beings. So there are unlimited uses of 3D printers. You will have to really think about what can be done. Same way IBM Watson, it is already ahead of its time. It was believed that in next 10 years it is going to defeat the human being in chess. It has already done that. So AI, artificial intelligence, machine learning, automatic vacuums, these are all coming. We need to adopt them for hospitals. I think we are considering the different fields. Healthcare is the field which is using the lowest form of technology in terms of hospital management. Clinicians are using the technology to the max, but hospital management, I think we need to use it more. Last question to Rajiv. I talked about the quality dashboards, and do you wish to use quality dashboards, or are you using quality dashboards or financial dashboards? And what can be done for effective marketing through technology?
I gave a few examples. So one was, let's say for marketing, we've been using social media plus, let's say a very simple thing, Facebook Live. I don't know how many of you have heard of it, but I found it to be a very, very powerful tool. In fact, in some of, the clinician interaction, I've seen around 20 to 25,000, people also being connected at one go. So it's been a very, very powerful tool from marketing point of view. Now, from dashboard point of view, I also give example of the business intelligence tool, which can do two things. One is it can churn out the MIS the way you want, but that's not the only thing. I think the second interesting thing in that is you can customize it to your requirement across different levels. So what is my requirement may not be the same requirement, let's say at a center head level, and we may be looking at the same set of information but different things out of it, and with the same business intelligence tool you can achieve that. So it really brings in that efficiency rather than somebody manually doing that churning out different report for different set of people at different level. You have the same tool that is able to do that all across. I think Dr. Gadhvi talked about very, very interesting thing about that IBM Watson. We did evaluate it. I think the only issue that we found with that is a cost. So we are still grappling with it because they say, per patient we're going to charge 6,000 rupees. So if you're going to charge 6,000 rupees and then, when the procedure will cost about 1 lakh, it's going to be a huge thing because hospital, if this is a cost to hospital, so hospital will put something on that, so hospital will charge at least 8,000-9,000 rupees. So, I mean, the point I'm trying to make is that we are in a market wherein, access to a technology is one part, but affordability is a very, very important part in adoption. So if there are some technologists over here, if there are people who are really thinking about and, listening to the group's narration, I think one very important message they should take is technology is great in Indian setting, but it should be affordable and it should be tailor-made to what is required at our level. What will solve our problem? It may be the greatest thing which may be in US, but whether it solve our problem at the price point we are looking at, that is the most important point.
It's a very valid point, Rajiv. And probably those who are already there, who are the technology stalwarts who are attending this session, maybe you need to have more interaction with the hospitals. Bring out the products which are going to be useful to us rather than what you feel are important. Unless you do that, whatever may be the technology, it might not be useful. And again, affordability. India is a country where still the healthcare costs are still kept at the minimum. We are actually promoting medical tourism through low-cost healthcare. And yes, but with volumes, probably you can take care of that. The Western countries may not give you that volume. In India, you will get those volumes considering the number of patients, the geographical dividend that we have. So all of you should think about how to innovate, how to use the existing technology in augmenting the hospital management, and how to reduce costs overall for the patient and for the hospital so that hospitals become more affordable and patients also do not feel the pinch. Thank you, everybody. Any questions? I would open the session to any questions, or anyone would like to share any technology that they've been using in the hospital. Which is one technology that all of you would like to use? Social media everybody is using, but they are using it for more of entertainment and fun. They are not using it for... Computerization is already done, so most of the hospitals are already there. That's not a problem. IT, computerization, I think that's...
Basic, I think HIS is...
Everything is there, only implementation is not there.
Yeah. Execution is where we are
It has to be compulsory for staff and for everybody is doing everything. Everybody is having everything. But what is going to be implemented, that is the
Another most important part is if we are computerized, like we all are the IT savvy, like everybody has a computer, laptops and everything. But if the data is integrated, then and then it's make a difference. Like a HCG is a cancer hospital. We are also operating cancer hospital. All these cancer patients, if they are like we see in our textbook what we learn. In Europe, this much of the patients are per year, this much have a colorectal cancer, this much have, but we don't have those type of data. If they all are combined anyway, at the single platform, then and then it is a useful. Otherwise, individual data, it won't make a difference. So that can be, it can be combined either by the webcast or anywhere. That is a time to do the analysis or the statistics of all this data.
Just on the lighter note, we are great at fudging data. So I don't know whether whatever data, right from the top post of this country to the bottom level, everybody fudges data. So I think only when we have genetic engineering and we infuse honesty genes in the Indians, probably we'll be able to get the real data. Thank you, everybody. Thanks for being participant.